important. They're life-saving interventions needed in acute blood loss and major surgeries, and in patients who have blood disorders and diseases. So there's an increased focus on trying to recruit more donors and to secure a sustainable supply of safe blood. And that's where a lot of research has been going in recently. So there are different types of donors. There's the voluntary donors, which studies have found that are usually motivated by altruistic intentions. And then you have the non-voluntary blood donors. So those include replacement donors, which I'll talk about a bit later, but that's usually donors who are donating for their family or friends who need it before surgery. And there are also statutory donors who are donating blood for either a driver's license or for a job requirement. And there's another subgroup of paid donors who are providing blood commercially. And it was found that amongst all these donors, the best were the voluntary, and it was the safest and had the lowest risk of infection as well. Next, please.
I've moved forward. I'm not sure.
Oh, sorry.
It could be just a delay.
Yeah, but so the study was focused more in my hometown in Saudi Arabia. So most of the statistics would be from there. And it was found that the majority of donors were non-voluntary donors. And this was a trend found in many other developing countries as well. And in one specific city, up to 81% of all donors were non-voluntary blood donations. So most hospitals have this no blood, no operation policy. So a patient is required to actually arrange for blood donations and a blood holding before they do any surgery. And they wouldn't be allowed to have the surgery if they hadn't done that. So it's usually coming and sourced from their family members, their friends or acquaintances. And these type of blood donations are usually less than ideal, because the replacement donors, or the ones who are providing the blood, are usually have short-lived motives. They're only doing it just for this specific friend or family, and are less likely to be retained. And there are some issues and ethical implications of insisting to have these type of donors, and there could be a lot of burden and burden placed on the family members and these friends with expectations that they have to donate in these scenarios. So when we're looking specifically at doctors and what the study focuses on, they can be such an important source of blood donations. They're more familiar with the importance of it, and as well as being familiar with the whole donation process. So, especially during the times in COVID where we have seen a sharp decline in blood donations, it's expected that doctors are a promising source of blood donations. However, many studies actually show that this is not the case. One study found in a university hospital that of all the potential donors, only 3.1% were physicians. And there was a local college survey, and they found that there was no difference between medical and science students and other students from other disciplines when it came to the likelihood of donating blood. So in terms of demographics, studies have shown that it's most likely a male who's married between 30 and 50 years old and having a higher educational level. So there were barriers to donate, the most common being actually not being asked. And of those who were asked, a survey found that half of them listed fear, medical reasons, and lack of time as their barriers to donating blood. And we can see here there's just some differences, again, from previous studies between the general population and then the physician population of barriers. So mostly the main was being site accessibility. So actually getting to these blood donation banks was considered a top barrier for general population. Whereas when it came to physicians, it was more fear of needles, not being fit to donate. And more interestingly, fear of knowing their medical status was considered a barrier. Perfect. So the study that I was a part of, it was qualitative. It was a questionnaire. It was an online questionnaire sent to the institutional emails of physicians and dentists in 2 large hospitals in Saudi Arabia, in 2 cities, Riyadh and Jeddah. So 113 completed the survey and qualified. And this is the first study in Saudi Arabia to report the knowledge, attitude, and practice of physicians towards blood donations. So from the results, 68% of all respondents were previous donors, which was positive. That was more than half. And the associations were similar to previous studies. It was male gender, younger age, being married, and interestingly, not being Saudi was considered an association. And when we looked at the reasons of why they donated, 88% of them had previously donated on voluntary basis, which again was great. 31% had previously donated as a non-voluntary, so either as blood holding, as I mentioned, for either a relative or a friend, and 20% previously donated and were prompted by hospital-based campaigns. It was interesting that there were differences when it came to the specialties within the hospital. So dentists were less likely to donate compared to other participants. There was a decreased proportion of pediatric departments compared to the other departments. It was interesting that surgeons were the most likely to donate compared to all the other specialties, and anesthesiasts were significantly less likely to intend to donate compared to the other participants. And when we looked then at the barriers to blood donations, we divided into two groups. So we have the non-donors who never donated before, and the top barrier, the most common, consisting of more than half of the reasons, was due to poor nutritional status and medical disease. This was then followed by time constraints, fear related to the actual procedure, and again, not being asked was mentioned. With regards to the previous donors who donated in the past, time constraint was the #1 barrier, followed then by both not being asked and having poor nutritional status. Of note, 44% of previous donors did not have any barrier to blood donation. We also wanted to look at the intentions of them to donate in the next 6 months. So of previous donors, 58% said that they intended to donate, and amongst those who've never donated, only 33% had the intention to donate in the 6 months. And when we looked at the positive predictors, they included younger participants were more likely, having a pleasant donation experience was significantly significant for a positive predictor, and donating in the last 1 or 5 years as well. And those who reported poor nutritional status or medical disease as a barrier was a significant negative predictor in intending to donate. So we also wanted to look at the knowledge, of blood transfusion needs and the donation process. And this was just a screenshot of the questionnaire. And generally, there was a low number of correct answers for majority of the questions. And it was found that the majority of the non-donors were the ones answering, quote, "I do not know," compared to those who have previously donated. And donating in the last 5 years had more correct answers compared to those who've donated longer than that. So in conclusion, as we can see, blood donation practices were strongly tied to physicians' socio-demographic characteristics, their specialty, and their knowledge of the donation process. And the most significant barrier to blood donation was found to be nutritional and medical disease status. And transfusion services need to engage in wider campaigns to promote voluntary blood donations and hopefully eventually eliminate the non-voluntary donor sources. And then just as the last slide, just some recommendations based on studies as well as personal views. Usually incentives were seen to have a very positive impact. So perhaps free time off work would be a way to promote voluntary donations amongst doctors. Improve the donation experience, as we've seen, can have a positive impact. Also, increasing awareness and knowledge could be very effective as well as an intervention. And regular reminders for donations, specifically for those who put down not being asked as a barrier. And also a study has found that decreasing the time interval between the blood donations was seen to have a positive impact as well. Thank you very much.
That was really interesting.